Hi there. My name is Christian Ridley. Today I'll be discussing generalized anxiety disorder, commonly known as GAD. GAD is one of the most common anxiety disorders and is characterized by excessive and persistent worry that is difficult to control. Unlike normal anxiety, the worry experienced in GAD is often present when there is no immediate threat, and it can interfere with daily functioning. It can also interfere with specifically relationships, work, and overall quality of life. In this presentation, I'm going to discuss the biological mechanisms that may contribute to GAD. I'll discuss how psychotropic medications work to reduce symptoms, and then I'll talk about the role of psychotherapy and integrated care. Excuse me. And the responsibilities of non-prescribing clinicians working with clients who experience anxiety. Individuals with generalized anxiety, as I said before, they often experience worry, but they experience a combination of emotional, cognitive, and physical symptoms. The common symptoms, can be restlessness, muscle tension, irritability, difficulty concentrating, sleep disturbances, and even fatigue. But I think the main one that you'll hear and that is persistent is just excessive worry. One of the defining features is that the worry is difficult to control and tends to persist across multiple areas of life. So as I mentioned, work, school, health, finances, relationships. Many people with GAD recognize that their worry may be excessive, but they still struggle to stop it. And over time, the chronic state of worry can become exhausting and significantly impact daily functioning. So I want to talk about the biological mechanisms of GAD. So current research suggests that generalized anxiety disorder develops through a combination of biological and environmental factors. So, family and genetic studies show that individuals may be vulnerable to anxiety disorders, genetically. Researchers have also identified several brain regions that appear to function differently in people with GAD. So, as we discussed with Dr. Kent in our child and adolescent course, the amygdala, which is the involved in detecting threats and generating fear responses, the prefrontal cortex, which helps regulate emotions and decision making, and then the thalamus, which plays a role in emotional processing and behavioral responses. So rather than being caused by a single brain abnormality, GAD appears to involve disruptions in communication between multiple brain regions that normally help regulate emotions and respond to stress. Um, Next, I'll talk about GABA and anxiety. So an important biological factor involved in anxiety is the neurotransmitter GABA. It's the brain's primary inhibitory neurotransmitter. Again, I think we talked about this in our last quarter. Its job is to reduce excessive activity in the nervous system and help maintain balance. An easy way to think about GABA is as a brake pedal. So when the GABA system is functioning effectively, it can help calm anxious thoughts and physiological arousal. When the system is not working as efficiently, people can experience increased anxiety and heightened stress. Research has found that changes in GABA functioning and GABA receptors are associated with anxiety disorders, suggesting that disruptions in the system may contribute to the symptoms of GAD. Neuroimaging studies have provided additional insight into the biological basis of GAD. So one study found altered communication between the dorsolateral prefrontal cortex, the ventromedial prefrontal cortex, and the thalamus in individuals with generalized anxiety disorder. And another thing from child and adolescent, the prefrontal cortex. So it's responsible for executive functioning, decision making, and emotional regulation. And the thalamus will help process the emotional information. So researchers found that individuals with GAD showed less flexibility in these brain networks, making it more difficult to regulate emotional responses and anxious thoughts. These findings will support the idea that GAD is not simply excessive worrying, but is associated with measurable differences in brain functioning. So, psychotropic medications. There are several medications that have been shown to be effective in treating this disorder, and the most commonly prescribed medication would be SSRIs. So, sertraline and citalopram are two examples. So these medications will increase the availability of serotonin, which is involved in mood and emotional regulation. The next group of medications are SNRIs, serotonin norepinephrine reuptake inhibitors, for example, venlafaxine. These medications can increase both serotonin and norepinephrine levels. And then the other options include pregabalin, which reduces the excessive neuronal activity, and then benzodiazepines, so benzos, which we're familiar with. They will definitely work to produce a calming effect rather quickly, but they're generally not recommended for long-term use because of the risk of dependence and tolerance. So I'll get into psychotherapy. Obviously, medication can reduce symptoms, but psychotherapy still remains an essential component of the treatment for GAD. CBT is considered one of the most effective treatments. It can help clients with their unhelpful thinking patterns. So, if someone has catastrophic thinking and excessive worry, you can challenge those. Clients can also learn about coping skills and behavioral strategies to reduce anxiety. Another one would be DBT. DBT can help with distress tolerance and mindfulness skills, and some other skills. And then ACT therapy, so acceptance and commitment therapy. And another one would be psychodynamic therapy. So any mindfulness-based interventions would definitely be helpful. But all these approaches can help clients better understand their emotional experiences and develop healthier ways of responding to the stress. Research consistently supports the use of an integrative approach when treating generalized anxiety disorder. So we talked about medication, reducing, the symptoms and some of the distress. But at the same time, therapy helps clients develop the long-term coping skills and address the psychological factors contributing to the anxiety. So in addition, many individuals with GAD experience challenges related to work, finances, housing, or social support, and case management and community resources can help address these stressors. So we just want to help them with overall functioning, and these things can be pretty effective. An integrative approach recognizes that effective treatment often requires attention to the biological, um, psychological, and social factors rather than focusing only on one aspect of the experience. Lastly, getting into the role of the non-prescribing psychotherapist. And so as a future LMFT who won't be prescribing medication, at least for now, I think we still have an important role in supporting clients who are receiving or psychopharmacological treatment. And I think we can help monitor the symptoms. We can provide psychoeducation and help clients understand their options. So I'll definitely need to collaborate with psychiatrists and other healthcare providers when appropriate. And I think therapists can often be in a unique position to spend more time with the clients. So we'll be able to notice changes in the symptoms, functioning, or medication side effects. I also believe that therapists play an important role in helping clients remain engaged in the treatment. So, we can connect them with resources that address some of the stressors, among other things. And in conclusion, I'll say GAD is very complex. It's a condition that's influenced by, the biological, psychological, and social factors. So there was a lot of research suggesting that the disruptions in GABA functioning, altered brain connectivity, and genetic vulnerability all contribute to the development of this disorder and of these symptoms. Psychotropic medications can reduce symptoms by targeting the neurotransmitter systems, and psychotherapy can help clients develop coping skills and then address the maladaptive thought patterns. An integrative approach that combines medication, therapy, and social support can often provide the best outcomes. So as non-prescribing clinicians, understanding all of these aspects of anxiety can allow us to provide more informed and effective care for these clients. Thank you.